Now, coming to the clinical implications. So there are plenty clinical implications when it comes to aquatic therapy. This is the new and upcoming therapy, but it has a lot of scope. The ease of doing movements and the freedom available gives an edge to the therapy. So it is more comfortable, it is more relaxed position for a patient to exercise. So water provides a really good medium for exercising, and again, like I said, it is a fun medium of exercise. It is not just exercise, it is not monotonous, and it also gives a different kind of feeling to the patient. It enhances the mood of the patient. The treatment session for adults lasts up to 45 minutes, and for pediatrics it lasts about 20 to 30 minutes, and it serves as an excellent adjunct to therapy on land. So you can take up land therapy on land as well as therapy on water, and the patient will be able to recover faster than if we were using just therapy on land. One aquatherapy session can be considered equivalent to 3 land physiotherapy sessions. So that's how effective aquatherapy is, and we should think more and more about inculcating aquatherapy in our normal therapy as well. Now we'll be coming to the concepts in aquatic therapy. We saw about the physical properties of water, we saw the hydrodynamic properties of water, and we also saw the therapeutic effects, the indications, the contraindications, how we have to be safe using the pool, and we also saw what are the clinical implications of aquatic therapy. Now we will be seeing, we'll be diving deeper into the concepts of aquatic therapy. So there are 5 concepts that we know of. The first one is water specific therapy or Halvix therapy. The second one is Badras Ring method. We talked about this when we saw the rings. The third one is aqua fitness, aqua aerobics or fitness. Fourth one is Aichi, and the fifth one is Aqua Relax. We'll be seeing about these concepts in detail in the future slides. So coming to water specific therapy or Halvik therapy. So this concept considers that the philosophy that in water everyone is at the same level, and it brings more emphasis on the ability rather than the disability of the patient. They think they have this philosophy that we should not consider that someone is not able to do a certain thing or someone is able to do more than the other person. Instead of that, we should consider everyone to be at the same level and start therapy in the water. So this concept, Halabic therapy, it has 10-point program. It is based on the 10-point program. So I'll be enumerating those 10 programs. First is the mental adjustment. You should be mentally adjusted to the pool and the aquatic environment. That is really important for the person to get very comfortable and natural and be relaxed in the environment to actually start the therapy. The second one is disengagement. The third one is sagittal rotational control. So in these points of 3, 4 and 5, what is actually done in the holic therapy or water specific therapy is that the rotation is started in the sagittal plane first. If it is a pediatric therapy patient, it is or an adult patient, in any case you can start with these steps. First, you will start in the sagittal plane, you will start rotating the patient. This is done basically by the physiotherapist or certified practitioner. They will start moving the patient from left to right. That will be the from in front and backward position. That is the sagittal rotational control plane. Then once the person has achieved good amount of sagittal control, then we will move towards the transverse rotation. So you will be rotating the person in a transverse motion. After that, the last one, once the patient has achieved the sagittal rotational control as well as the transverse control, then you will go to the longitudinal rotational control. That is the 5th step of the Halabic therapy. After, once the patient has achieved all 3 forms of rotation, now we will give combined rotational control, and we will see if the patient is able to achieve that inside of water. Then we see about the upthrust or mental inversion. So upthrust is basically the force of buoyancy, giving an upthrust to the patient and making the patient float. So once we have achieved all the rotational controls, then we will ask the patient to actually lie flat on the water and experience what bliss it is. And also the patient will be able to get that sort of control on their body. All sorts of or the whole body will be involved, and the patient will have more and more control over the body. And then there is balance and stillness. So the patient should be able to except that once the patient has is lying in the upward direction or is lying on water, he should be able to balance in that stillness. Then there's turbulent gliding. In the slide about turbulence, I had said that we can use turbulent gliding in terms of the increase in the velocity of the water and increase in the resistance. Turbulent gliding can be used to initiate movement, to give resistance to the movement, and basically for strengthening if we use it as a resistance property. The 10th point is simple progression or the basic swimming movement. So this program, the water specific therapy or halobic therapy, they basically say that we should complete these 9 steps, and only then should the patient be able to swim. So we will not ask the patient to directly swim inside of water. We will first complete all of these 9 steps, and then basic swimming movement or simple progression will be continued for the patient. So that was about the water specific therapy or halobics therapy. The next method is Badras Ring method. So, Badras Ring method, which is also known as BRRM, it is a collection of therapeutic techniques performed in the water that have been developed through years in the thermal waters of Badras, Switzerland. So, this is basically where it gets the name from, Badras Ring method, because it was done in Badras, which is a place in Switzerland. This is still an evolving method which is used internationally for muscle re-education, strengthening, spinal traction or elongation, relaxation, and tone inhibition inside of water. The apparatus used for Badras ring method include a neck ring float, large body ring or a life jacket, and a small ring float for the lower extremities. So there will be 3 rings which will be used. Like I said in the picture we saw for the rings, it is used in Badras ring method. And this technique involves the use of PNF techniques. So when the patient is immersed inside of water, the rings are used for assistance and the PNF techniques are given. That is your Badras ring method. So here we can see that the therapist is helping the patient. There are 3 rings. One big ring is attached near the trunk of the patient. One is for the neck, and the last one is near the lower extremities. That is your Badras ring method. Now coming to aqua aerobics or fitness. So aqua aerobics or fitness is basically used for people who want to either reduce weight, ones who are obese, who want to reduce weight, or who want to reduce weight faster or quickly. It can be used for patients like that, because water, again, like I said, one aqua therapy session is equal to 3 land sessions. So this will be helpful for the patients who want to reduce weight quicker. Okay, so the patients who are obese or who are looking towards reducing weight quickly, they can be doing aqua aerobics or aqua fitness. Second one is patients who want to increase the cardiovascular fitness or cardiovascular endurance can also use aqua aerobics or fitness, and again it can be quicker than the land therapy. And as well as patients, women who are pregnant or women who have just delivered, they can also be going for aqua classes or aqua aerobics. And one more very important segment of aqua aerobics is that it can be used for geriatric patients. Geriatric patients can also have group classes. Group classes again will enhance your confidence, will boost your motivation, because you'll be seeing a lot of people exercising along with you and not just you alone, because exercise on land can get monotonous. So here you have the company of your friends, the company of people who are exercising along with you. Here we can see a trainer who is training as to what movement the clients or patients have to be doing inside of water. There's also a concept of aqua zumba which is used, where you use music to dance to the beats, or you use it for exercising. So here the aqua aerobics aqua fitness session, the warm up is for 5 minutes. The aerobic training is for 25 minutes, where you actually do the different forms of exercises. The balance or static balance training is for 10 minutes, and the motor function for upper limb, it is for 15 minutes. And lastly, we will be ending with ai chi or stretching, which will be for 5 minutes. So warm up in the start, aerobic training, static balance training, and your upper limb training will be in the core set of the exercises, and your ai chi or stretching will be for 5 minutes. It follows basically very much the protocol we follow on land. It follows in water, but again it is more energy consuming. It gives more resistance to the patient, so it because the resistance is higher, it provides the results also very much quickly. So that was about aqua aerobics or aqua fitness. Coming to I Chi. So I Chi is a very different form of aquatic therapy. It is very different from what we saw earlier. So this method was originated by Jun Kuno in 1955, and it is designed as an individual preparation for Aqua Relax progressing to I Chi Ne, and it is based on Zen Shiatsu. It's a different form again. Zen Shiatsu is a progression of I Chi, so it is based on the Zen Shiatsu by Masunaga, and these are concepts given by different people all around the world, and it is a water based total body strengthening and relaxation progression. It bridges the east and west philosophies, and it integrates the mental, physical as well as spiritual energy. So we know how the east is known for the spiritual practices, or more and more about the spiritual aspect of health as well. So this is a form of aqua therapy, I Chi. It uses water to give you mental, physical as well as spiritual relaxation, and it gives overall healthy benefits to the patient. So here they see the patient as an overall body system and not just one part of the patient's body. So it combines the concepts of Tai Chi with Shiatsu and Watsu techniques, and it is performed standing in shoulder depth water. So the person will be standing in shoulder depth water, and the temperature of the water is about 30 to 35 degrees Celsius, which is comfortable for the patients, not too hot or cold. And it is used and it uses a combination of deep breathing and slow broad movements of the arms, legs and torso. So like we've seen in Tai Chi, the concept involves broad long movements, and basically they make you concentrate more and more on the breathing as well as the movement. So you have to be very slow with the movements. You have to actually feel the movement of each of your body parts and concentrate on your breathing as well. So I Chi is first, the demonstration of I Chi is given on land. Along I Chi also uses some sort of relaxation music, and the practitioner will actually be showing you the different kinds of movements that you need to be doing in terms of I Chi on land, and then you can progress to do those same movements in water. Again, the practitioner will be providing the demonstration in water as well, and this needs to be done in a certain number of repetitions that will be decided by the certified practitioner. So we see here, these are the different sorts of I Chi postures. So here the first one is contemplating. You actually sort of store your energy. The second one is floating, where you will take your hands up and you will take your hands down. Again, you will take your hands up and down. The third one is where you take your hands up from the side and again down. The fourth one is enclosing, where you bring both your hands closer together through the surface of the water, that is enclosing. Then the fifth one is folding. We can see the picture of the upper limbs of the patient, and the legs will always be in this position. The legs will be abducted and the patient will be standing in shoulder depth water immersion. The fifth one is folding. The sixth step involves soothing, where you will be, both your hands will be by the side and you will be taking one hand to the other hand. Okay, gathering as well involves a similar procedure, where you will be turning your whole trunk to one side. And the last one is freezing. So this was about the Tai Chi postures. So I Chi is basically a form of relaxation, you can say. More of the spiritual practices or the breathing practices uses I Chi. And again, I Chi, like we saw in Aquatic fitness, it is used as a form of cool down therapy, or along with stretching. It is used in aqua fitness or aqua aerobics. That was I Chi. The last one we have is Aqua Relax. So Aqua Relax is basically again a procedure which is performed by the physiotherapist. So Aqua Relax is a technique that is passively done by the physiotherapist. So here you can see in the picture that the person is actually just immersed inside of the water, and the physiotherapist or the certified practitioner, they actually move the person through the water. So the movement can be either you hold the upper part of the trunk or the upper limbs of the patient, and you try to move the lower portion of the I'm so sorry. So you move the lower portion of the person's body, and you ask the patient to either close their eyes so that they can feel the relaxation even more. So that's where it gets the name from, the Aquatic Relax. It is basically relaxation of the body. The person does not has to basically give control of their body in water to the physiotherapist, and they will be performing the movements. It can be any sort of movement. The person can actually be swapped as well and turned inside of water. They can be doing transverse rotations, they can be doing longitudinal rotations. Again, you can either hold the patient from the lower limbs as well and try to move the upper part of the body, and you can do trunk elongation as well in terms of Aquatic Relax. And that's about Aquatic Relax. Again, it is used like Aichi. When you want to end the aquatic session, you can use Aquatic Relax, and the person will feel completely relaxed and enhanced, and will be in a positive state of mind. So that was about Aquatic Relax. We saw 5 techniques in the concepts of aquatic therapy. The first one was water specific therapy or holobic therapy. The second one, the first one had 10 components of holobic therapy. The second one was Badras Ring method, which used the ring, 3 rings, one for the lower limb, one for the neck, and one for the trunk. That was the Badras Ring method. The third one is Aqua Aerobics or Aqua Fitness. The fourth one is Aichi, which is a form of relaxation, uses a lot of spiritual energy, and music is used for Aichi. And the last one is Aquatic Relax. So these were all the concepts of aquatic therapy that we saw, and this was about aquatic therapy from my side. I hope you got to learn from this session, and thank you so much.